Welcome, Joslyn Center Facebook Friday, Interview Friday fans. This is Jack Newey from the Joslyn Center. Welcome. I apologize about those technical difficulties we experienced, but it seems to have been resolved. So before we get into our interview today, I wanted to go over a few things that we're doing here at the Joslyn Center coming up in the next week. So of course, we're approaching our Independence Day holiday, and so the Joslyn Center will be closed on Monday and Tuesday, July 3rd and 4th. And so we wish you all a happy holiday, and those of you that have reservations, we will be seeing you at our 4th of July lunch a little later today. Wanted to let you know about the Joslyn Center is a cool center. And that means when the temperatures are high, and we've been lucky this year, so far they haven't been bad, but the forecast is they're going to be well in excess of 100 degrees. So you can come in and enjoy the Joslyn Center and our classes and activities and have water and snacks and enjoy our air conditioning and turn off your air conditioning or turn down your air conditioning at home to save on your electricity bill. So anytime the temperature exceeds 100 degrees, come on down and be cool and stay cool at the Joslyn Cooling Center. We have rescheduled our bridge lessons. So we did say that's coming up, but watch for the update. Also, we have a new gardening club series. The next one is on Monday, July 31st, and that begins the planting and selection of the garden you will be planting. So that's going to be something new and fun. Also, our Brain Boot Camp is coming up in July 21st and 28th. That was developed by the UCLA Longevity Center. Really some great tips on boosting your memory and on how to stay healthy and the foods you should eat and other things you can do to improve your brain health. If you are depressed or anxious or have relationship problems, you can come to the Joslyn Center for our problem-solving strategies and meet with a counselor and help you get past those things. And you know, we all have problems in our lives, and sometimes talking it over with a counselor is a great thing to do. And finally, our basketry course with John is coming up Wednesdays from 10 to 11. And that's actually to learn basket weaving, and that's presented by the Braille Institute. We're really happy to be collaborating with the Braille Institute on the things we do. And finally, pickleball lessons with Henry on Thursdays from 11 to 1. And then Fridays 10 to noon, and there will be time for actual pickleball play after the lessons. So a lot happening at the Joslyn Center. Check out our website at joslyncenter.org. So now it's time to get into our interview and to talk with Rachelle Spencer, who is the CEO of VIBRA Rehabilitation Hospital in Rancho Mirage. Hi, Rachelle, how are you?
I'm fine, thank you.
Sorry about those technical difficulties we had at the beginning. I think what happened is a second Facebook page opened, and we had that awful echo I warned you about that would happen.
Technology, you have to love it.
Technology is fun. Luckily, I get to edit out that part of this interview Friday. So tell us a little bit about yourself first. Our listeners always like to hear a little bit about the person we're talking to.
Certainly. Great. And thank you, by the way, for inviting me to your show. I really appreciate the opportunity. So I'm Rachelle Spencer, and I'm the CEO at VIBRA Rehabilitation Hospital, Rancho Mirage. And I have been here in this position for just coming on 6 months. So brand new to the desert, brand new to the hospital. And I know you'd asked me before about my background, and so I do have a business degree. I'm not clinical, and then an MBA from Arizona State University. So I'm a Phoenix native and sort of a fellow desert rat. So that made a difference coming here.
Yes.
I've heard a lot about the heat. I'm like, you know what? I don't have to like it, but I will not, I'll live, I'll survive. So I know what it's like. But I moved here most recently from Albuquerque with my husband, Jim, and we've been married for about 33 years now. So.
Well, welcome to the Coachella Valley. And now tell us a little bit, because VIBRA Rehabilitation Hospital, the rehabilitation part might be a little bit different for people. And tell us how it's different from maybe just a short-term rehab. Explain to us, is it actually a hospital or?
It is we are licensed as an inpatient hospital, so we're inpatient rehabilitation. And so what that means really in how we're different from a skilled nursing facility, for example, is that that clinical overtone. So patients to come to us, there has to be a medical need, medical necessity. And so that's key. There's a medical condition that needs to be managed by a physician. We also have a team of an interdisciplinary team of a lot of different practitioners, and they manage the care. They develop care plans and develop, and evaluate the patient weekly to determine, do we need to tweak that plan? How are they progressing? So that's a little bit different. Also, too, is the amount of therapy that we offer. Patients that come to us need to be able to participate in therapy for a total of 15 hours combined therapy per week. And by combined therapy, we mean a combination of physical therapy, occupational therapy, and speech therapy. So they need to be willing and able to participate in therapy. And then they have to be expected to make gains with us too. We need people that can participate and that we're not hospice per se. And so, that we want them to get better. We want them to get home. We do discharge more than 80% of our patients to their homes, which is really great. And so, so those are a few of the differences related to us in skilled. And also, I think, the big difference too is that the physician component, you will be seen by a physician every day here. And that's really not the case in skilled. But, I do want to say, though, there's a place for skilled and there's a place for us. We're just a little different, but there's room for all of us in the healthcare post-acute continuum.
So tell me about some of the conditions that you might treat or that might be presented, whether it's an injury or the type of condition that will bring someone to VIBRA Rehabilitation Hospital.
Certainly. We see a variety of diagnoses that come to us. We see a lot of, hip fractures, strokes, COPD, joint replacements, post-amputations, people that have had brain injuries, traumatic or otherwise, Parkinson's, neuropathies. The list is very, very long. But again, we're looking at that criteria. Can they, do they have a medical need? Can they participate in therapy? That sort of thing as we're looking at these diagnoses. So, patients come to us from a lot of different sources. A lot of times people think that all of our patients come from hospitals. The majority do, but they don't have to come from hospitals. We can take patients from a home setting, from urgent cares, physicians' offices. We have referrals from home health agencies that are in the home and determine that the patient, could benefit by spending some time with us to regain their strength. Maybe they're falling a lot at home and we can work with them and get them stronger. We can see patients that are maybe going to start chemotherapy even, and they need to be strengthened a little bit before they go start their outpatient chemotherapy. So variety of diagnosis. The best thing to do is, if in doubt, call us and we can take a look at that, and we can send our clinical liaisons either into the hospital or into the home or any other setting to evaluate the patient, gather information, and then we would determine if the patient would meet criteria with the input from our physiatrist, and that is a physical medicine, internal medicine doctor. And they're actually the person that determines who meets criteria in this setting. They have the final say on that. So, if somebody is in the hospital and they would like to come to us, they just need to let their case manager know, their discharge planner know, I'd like to come to VIBRA, and we'll get the referral and then we'll come and visit them.
So what is the typical stay for a patient at VIBRA?
It's going to depend upon what their diagnosis is. And so, but on average, patients stay with us between 12 and 14 days. But it would just depend. If we're going to just strengthen up somebody, because they're falling at home, their stay may be a lot less. A stroke patient, for example, maybe a little bit more, but on average, about 12 to 14 days.
So this isn't like an assisted living or anything like that. This is really intensive medical care for the purposes of rehabilitation.
Yeah, well, we like to say it's intensive therapy supported by medical care. I think that's probably a better way to look at it, because if you come here and visit us, it's very vibrant. You'll see people in our gymnasiums, you'll see them in our courtyard working with our therapists, you'll see them making laps, doing whatever. We take them to outside settings for therapy as well. There's a lot involved, so it doesn't feel like skilled nursing. It's much more vibrant. But again, we do support them medically here too.
So what's on the horizon for VIBRA? Anything new coming up?
Well, a couple things. So, one is, one of my goals being here is to really continue the great work that's been done before I got here. And so our patient outcomes, our patient satisfaction, they're already very, very outstanding. And so what I want to do now is work on growing the facility. We opened up pre-COVID, but a lot of those years, we've only been open almost 5 years now, have been through the COVID years. And so we have been working hard, staffing up, getting all of our employees in place to begin to grow the facility. So that's one of my goals, is to go ahead and grow us now. So we've got some bed capacity. We're 50 beds. And so we're not full. We're doing really well, but we're not full. We can always find room at the end, right? And so I want to grow us. And I'd also like for us to take a look at the next level in terms of our certifications. We're certified by the Joint Commission right now. And so they have some additional specialty certifications around things like stroke, brain injury, spinal cord injury. And so I'd like for us to start working on those now. And so that's a goal of mine. But we also have something really big happening for us. It's sort of invisible to the public, but at some point it will be more visible. But we've been kind of changing a little bit in terms of our ownership operation, if you will. And so we've been owned by Ernest Healthcare for about 4 years. We were opened by VIBRA along with Eisenhower. We're a joint venture with VIBRA and Eisenhower. And I must say, we're very, very proud of that relationship with Eisenhower. And so now what's happened is Ernest is going to be operating us in addition to owning us, along with our joint venture partner, which is Eisenhower. So that's exciting for us. It's a lot of changes here as we transition to procedures, policies, all those types of things under Ernest. And so very, very exciting. And one of the things that will be happening is a name change, because our name is VIBRA. And so we'll be rolling that out in the next month or two. Right now, we're going through the approval stages on the new name. So that will be something outward facing that the public will see, and they might wonder what happened, So we're still the same facility that we've always been, still owned by the same company that we've always been, still joint ventured with Eisenhower. You'll just see a name change to reflect being operated by our owner now.
So one question I didn't ask earlier, are there other similar types of hospitals here in the Coachella Valley, or are you the only one?
We are the only freestanding inpatient rehabilitation hospital. Now, Desert has some within their hospital, they have some inpatient rehab beds, a unit, but it's much smaller. It's nothing quite to the scale of what we are, but we are the only one in the Coachella Valley like this.
Well, that's good information for people. And speaking of information, if people wanted to get in touch with you, is there a website they could visit or a phone number they should call?
Certainly. You know what? The phone, I knew you were going to ask me that, and I'm not ready. I knew that. You can always go to our website, and so you can just look us up under VIBRA, and we'll come up. And then there's a link there. There's also phone numbers there as well. So you can call the main number off the website. And then there's some numbers if you're interested in having the liaison come out and learn more about being admitted to the patient, to the facility. There are numbers also on the website.
Okay, and that's VIBRA is what people would look
VIBRA.
for. Okay.
Yeah.
Well, I want to thank you for joining us this morning. Again, I apologize for those technical difficulties we had. A lot of good information. And again, you take a certain niche in the community that I think is very important for people to be able to have that hope and know that instead of being in a long-term care facility, for instance, that there is hope for their rehabilitation, that they would be able to go home having been taken care of in a rehabilitation hospital. So
Absolutely.
that seems very important to me.
It really is. And, we can get patients home sooner, safer. And, so what we really want everybody to understand is come to us first, and your outcomes will be better, and we'll get you back home. That's the plan.
Well, Rachelle Spencer from VIBRA Rehabilitation Hospital in Rancho Mirage, I want to thank you for joining us. Where are you located in Rancho Mirage?
We are at the corner of Duval and Ramon.
Okay. So easy to find if people want to look for you. And again, VIBRA, VIBRA is what you would look for on the website to find out more information. Again, I want to thank you and wish you a very happy holiday coming up.
Thank you.
And a good weekend.
Thank you. You as well.
And again, thank you for joining us. And again, my apologies for our little technical difficulties at the beginning.
No worries. Thank you for the opportunity.
So have a great weekend. And for our listeners, also a great weekend. Thank you.
Thank you.
Bye-bye.